Hello, I'm Greg Sattler.
And I'm Mia Landon, and we're going to talk to you a little bit about Cri-du-Chat. So, Cri-du-Chat is a genetic disorder that's caused by a deletion or a translocation on the short arm of chromosome 5. It was discovered in 1963 by Jerome Lejeune, who was a French pediatrician. He, at the time, was in the middle of Down syndrome research, and so it was not until almost 10 years later that they began more extensive study of the genes affected. Cri-du-Chat is a rare disorder affecting between 1 in 20,000 to 1 in 50,000 newborns. It can be caused by either a deletion or a translocation. In the case of a deletion, it occurs randomly due to unequal recombination during meiosis, which most typically occurs in the father's sperm. In the case of a translocation, the mutation is inherited from an unaffected parent. However, this is exceedingly rare.
So, Cri-du-Chat is considered a spectrum disorder, meaning that it can be expressed on a mild to severe scale depending upon the size and location of the deletion. This figure shows the short arm of chromosome 5 mapped according to the symptoms caused by a deletion of their respective genes. So, for example, a patient with a deletion within the 15.2 to 15.3 range would not display the severe mental retardation and microcephaly of a patient whose deletion spanned from 13 to 15.3. So some of the most common physical symptoms are listed here with their percentage of prevalence. So you have abnormal dermatoglyphics, meaning the simian crease extends all the way across the palm. Micrognathia, they have smaller than average jaws. The typical cat-like cry, a low average birth rate. Microcephaly, they have a smaller than average skull circumference. Abnormal epicanthal folds in the corners of their eyes, a large nasal bridge, hypertelorism, wide-set eyes, downward turned corners of the mouth, a round face, and low-set, abnormally shaped ears. So there are some other symptoms which typically develop later in life, where the face becomes longer and narrower, the supraorbital arches become more prominent, the philtrum becomes shorter, the lower lip becomes more full, dental malocclusion develops, palpebral fissures become more horizontal, and divergent strabismus or cross-eyedness is common. They also have shortened metatarsi and metacarpi, so they have small hands and feet.
While Cri-du-Chat can only be verified through a blood test, it is important to first recognize some of the common symptoms that indicate this disorder. So, the most obvious is the cat-like cry. It's a high-pitched noise that newborns make. It's caused by abnormal larynx development, but typically it appears around age 2. They also have a transverse simian crease that extends horizontally all the way across the palm. Microcephaly, clearly, which is just smaller than average head size. And hypertelorism, which is the wide set eyes and also accounts for the wide nasal bridge. Oh, and abnormal epicanthal folds in the corner of the eyes.
So if a doctor suspects that Cri-du-Chat is responsible, they should order a blood sample, and the first test to run on this would be a karyotype analysis in order to try to visualize the deletion. To further verify this, a secondary test is run using FISH analysis. This stands for fluorescence in situ hybridization. It's kind of similar to a southern blot. It uses a single-stranded complementary DNA probes labeled with a fluorescent dye in order to locate the desired genes on the chromosome.
While there is no cure, there are several therapeutic treatment options that help manage the effects of this disorder, and those include occupational therapy, physical therapy, speech therapy, and then there are a few alternative therapies. So, occupational therapy helps patients refine those fine motor skills that are necessary for everyday basic self care. That includes brushing their hair, getting dressed, and feeding themselves. At the same time, it also helps improve their relatability to the world around them in that they can perceive outside inputs better and respond to them more appropriately. Physical therapy, on the other hand, helps improve coordination and build up muscular strength in order to teach them to sit, stand, walk, run, etc. Speech therapy really helps patients overcome more physical abnormalities of the larynx that are associated with the disorder through speech exercises, as well as to overcome their mental disabilities so they can develop stronger verbal communication through various learning techniques. There are a few other alternative therapies Those include aromatherapy, aquatic therapy, which helps again in building up their muscles, hippotherapy, which uses the movements of a horse to provide a steady source of motor and sensory input, and music therapy.
So the general prognosis for Cri-du-Chat patients is that they can expect to have a normal lifespan, and through these various therapies, they can learn to care for their basic needs in everyday life, and they can also develop relatability and communication skills that are needed to maintain relationships with people around them. So, thank you very much.